We want to join with Job. Job is a public health officer from Denton County, Texas. Job Nyagenya Omanga, who is standing by. I think it is at night there in the United States right now, right? So good evening.
Good morning, Depar.
Right. Good morning to us. All right. Good evening to you. Confusing there. But yes, we are trying to just compare notes as it is right now. We know also the United States is on a lockdown as it is right now. Maybe you can just give us the current state of play of what is happening in Denton County, Texas. You're the public health officer there. How are people combating the coronavirus?
Thank you so much, Depar, for the opportunity. I want to say that across the nation, many of us are feeling very anxious about the rapid spread, the COVID-19, otherwise called the coronavirus, and the threat it has posed to our health, our loved ones, and our livelihoods. Here in Denton County, we have had 3 cases of people who have been in contact with somebody who had tested positive, but we don't have any positive patient who has been confirmed here in Denton County. The county has taken immediate and appropriate measures to make sure that the residents of Denton County are safe. First, they made sure that all schools are closed, and then the health facilities we have in our county have to, we introduced new policies where nobody should go to any health facility in the county, and nobody should come out except healthcare providers. On the 13th of this month, the mayor of Denton City declared a state of emergency here, following the Federal Emergency Management Agency rules and guidelines. After that, Denton County followed and they declared a state of emergency. It was followed by the state of Texas, and eventually the President of the United States, Donald Trump, declared COVID-19 a national disaster. However, I want to say that mechanisms have been put into place here to make sure that each and every person is safe. Those ones who have tested positive are quarantined and put in separate rooms where they should stay for at least 14 days. And those ones who have been in contact with anybody who tested positive have to be quarantined for 14 days too. So mechanisms have been put in place here, and each and every person has been asked here to make sure that they become part of the stakeholders to curb this pandemic disease.
Right. Maybe also just to interrupt you with our panelists as well, they have questions for you. We can begin with you, Herman Manyora, or Dr. Nyikal as well. Do you have any good questions for Job there in Texas? Dr. Nyikal?
Well, what I would want to ask him, how are they dealing with the local movements of people within the county and inside and outside the county? That is important in terms of prevention.
Okay. Job, if you got that, you can answer.
I did not get what Manyora asked.
No, this is Dr. Nyikal. He's asking you, you can actually repeat the question.
How did you deal with the movement of people within the county and moving out and into the county?
Thank you so much, Manyora. That one, you cannot be able to control the movement of the people per se, but there are policies that have been put in place at specific places. Let's say the nursing homes and the hospitals and the institutions of running. Now all schools are closed. The universities where we are in Denton County is the University of North Texas and the Texas Woman University, and we also have a college called the North Central Texas College. All those colleges are now closed, and all the students have now received email telling them that they are going to transition to online classes to end this semester, which is ending in May. 3, all health care facilities, they have put mechanisms in place to make sure that Before anybody gets there, and of course I say it's only healthcare workers now who are allowed to go to those facilities, they have to be screened so that we make sure that if anybody has a temperature of more than 100 degrees, he cannot be allowed to go into the facility, and no patient goes out. So that is the mechanisms that have been put in place, and we are monitoring this thing. It is under serious surveillance to make sure that anything that is going to threaten the safety of the people and the residents of this country is well taken care of.
Right. Okay, you were speaking with Dr. Nyikal. Now Haman Manyora is on. Haman has a question for you as well. Haman, you can actually, fire away your question.
Job, now this is Manyora you are talking about. I just want to know what is your capacity in terms of the beds that you have set aside for use for purpose of isolation and quarantine in your hospitals. But for that question to make sense, what is the rough population of your county? The population of your county and the bed capacity for quarantine or isolation.
Thank you so much. I think this is Senator Omogeni.
No, this is
no, this
Haman
Manyora
Manyora.
talking to you. The other one was
this is
Manyora.
Manyora. Okay, this is Manyora.
Yes,
well,
yes.
I'm not working at the hospital, Professor Manyora, at this point. What I'm saying here, we have health facilities in the county, and we have two major hospitals in the county, which I know they have set aside enough rooms to take care of the patients. But I know if we have overwhelming cases, we cannot be able to manage all of them. That's why we have the city and the county and the state and even the federal government working together. But at this point in time, every nursing home in Denton County, every hospital in Denton County has a room where any patient who is suspected to be having the coronavirus, otherwise the COVID-19, is going to be isolated. If anybody is at home and is suspected that he is having the COVID-19, maybe is having the signs and the symptoms of COVID-19, he has to call the emergency, that's 911, and he or she has to tell them that he is having the signs and the symptoms of the COVID-19, so that when these people are coming to get him, they should be prepared to come and have contact precautions when they are going to get this person. You have to call the doctor and tell him your signs and symptoms before they come.
Thank you.
3, at home, each and every person has been advised, if you have the signs and symptoms, move from your family, go to an isolated place, and call 911 immediately.
All right, so up next we have Okongo Omogeni, who's standing by just to ask you a question as well. Okongo, you can ask him a question.
Yes, Job, I just want to know from your end, the healthcare providers, the nurses, the doctors who are doing the screening of, people are suspected to be having this virus. Are there any mechanisms in place to ensure that they are also protected? Are they using any protective gear, or they're just doing the testing the way you'll do it for a normal patient? Is there any measures to protect the medical care service providers?
Thank you, Senator Okongo. First of all, I have to thank all those who are making sacrifices to protect us, whether they're self-quarantining or canceling events, and those ones who have put their lives on line to make sure that we're safe. The county has made sure that these people have sufficient training, and the training is ongoing. And there is enough supplies and equipment to make sure that these people, wherever they are going, first of all, they are safe. So the safety of the healthcare providers is number one. You cannot be able to take care of somebody if you are not safe yourself.
All right, thank you. We have Alice, lastly, who will also ask you a question. Alice?
Yes, Job, I'm Alice Wahome, MP Kandara constituency. I'm concerned about self-quarantine, Job. How are we enforcing that in your county there? Because I'm looking at the Kenyan situation where I have a family and I need to self-quarantine and I don't have any other place to go. You have said that you have been advised to, the public in your place have been advised to call. Then once you call, are you then taken to the government managed isolation place, or how is it happening?
I'm not sure if I got Mheshimiwa Waume very well.
All right, she can actually just
The,
repeat
the
the question.
concern is about
Just be very
self-quarantine.
pointed with the question,
Yes.
Alice, yes.
Yes, the concern is about self-quarantine. How are
Yes.
you able to implement that, and how do you think we can handle it here in Kenya? In your county there, when you self-quarantine in a family, what are you supposed to do? Are you supposed to stay in a separate room or outside? You said that you call, but as you call, where are you in the meantime? And how soon are they able to maybe either take you to isolation?
Thank you, Mheshimiwa Waume. Now I think I got your question well. You know, when we're doing self-quarantining, for instance, if we're telling you to self-quarantine, it means, first of all, maybe you have not been infected or you don't have signs and symptoms. So we're telling you, don't get out, don't go to work, stay at home. That is self-quarantining. If you have signs and symptoms and you are at home, then you need to call. If you are calling, then it means the people in your family are also going to be tested. We're not testing anybody. We have not done random testing at this point. We're only testing people who have the signs and the symptoms of the COVID-19. And remember this, Alex, this disease can only be won when we have collective responsibility. Each and every person has to be responsible. When you are at home, nobody will be able to know if you are having signs and symptoms of the COVID if you don't say. That's why the media is there to educate and tell people that if you're having a fever of 100, if you are throwing up, you know, if you're having difficulty breathing, then you need to call so that people can come and get you get tested. I know in Kenya it is a little bit tricky. It's a little bit hard to self-quarantine people, even when we look at the way we have movement in the country. For instance, the president yesterday gave an order that all schools should be closed. These students are going home today. They are going to use public means. How safe are they from school home? When they go home, what mechanisms have we put in place as a country to make sure that these students will stay at home till the COVID-19, otherwise known as the coronavirus, is completely solved? So in Kenya, I know we don't even have enough supplies and equipment to test people. I heard from my county in Kisii, the director of health, my friend, saying that if they suspect anybody who is having that virus, they are going to get him and send the sample to Nairobi to get tested. So we don't have enough supplies and equipment to test. I urge the government, if possible, and also you guys who are in power, make sure that all the 47 counties in Kenya have enough supplies and equipment so that people can be able to be tested right there at the county, and we have enough resources to have those people quarantined. The PAL, it's important for me to say this. In Denton County, $50 million was set aside for anybody who is going to be infected or affected by this. Number one, no utility is going to be cut for them. Electricity is not going to be shut down for anybody in the county because they are not going to be able to pay, because people are not going to go to work. Two, nobody is going to be kicked out of the house because he's not able to pay for the mortgage or the rent because of this pandemic. So money has been set aside to make sure that people are safe. Leaders in power, that is the role we have to do.
Right. Thank you, Job. Maybe lastly, you've declared there in the county that it's now a national disaster. And I wonder what dynamics that is really change as far as the government's approach is concerned when there's a pronouncement of it being a disaster.
Well, first of all, on the ball, you need to know that whether it's a national disaster or a local disaster, the first line of defense is the city. So the city is the one which is dealing with the problem in that city. So in Denton County, we are now helping the city, and we are also getting reinforcement, the resources from the state and the federal government. When the thing is out of control, when the city is overwhelmed, that's when it asks for support from the county. And if the county is overwhelmed, it asks for support from the state. And when the state is overwhelmed, then they go to the federal. That's why we have Federal Emergency Management Agency, which is available now, run by the national government, which is helping to curb this problem, working together with the city, the county, and the state. We don't have that one in Kenya. And I wish Mheshimiwa Alice Wahome should take that one to the National Assembly so that we can have a national emergency management agency that can be able to help the county and even the constituencies down to our county assemblies in managing problems of this nature.
Right, thank you very much. Unless you have any question for him, we can, yeah. I think you've done exhaustively well, and I thank you so much for your contribution, Job, even as you're making sure the people of the county of Dayton, that is in Texas, also are keeping safe. We wish you well in America, which is under lockdown as well. We are learning more, and of course we shall be comparing with you moving forward as well. Thank you very much for your contribution on AM Live.